Hi everyone, I'm Premkumar Genason and good morning everyone. Okay, today morning we are here to discuss about one of our ethics case and then once we discuss our ethics case, we also going to answer for that case of total 5 questions. So I hope each and everyone will give your contribution as well to bring our discussion to effectively. Okay. Yeah. Okay. So before we go through the case, I just try to give you a brief summary regarding the case. The title of this case is deciding who receives the swine flu vaccine, because basically this case is about the H1N1 uh, swine flu that it's one of the dangerous disease before the COVID-19, but this disease is famous during 2009, I guess so. So basically this paragraph, they want to highlight that uh, during the year of 2009, H1N1 flu pandemic, it's already took over many of the countries, around the world. So the World Health Organization, they want to provide the swine flu vaccine, for all the affected people. But for the if but for the affected people, this kind the H1N1 disease only will get by the people who are young age, people who are old like or above 61, they usually won't get this disease. More than 60, they usually won't get this kind of disease. People, the most common people who easily can affected for disease are children and pregnant women. So the main priority is given for them. uh, and then for the priority itself, some people, they really waited for so many long to get this vaccine, but unfortunately they just suddenly announced that the vaccine is finished. It is a disappointment from them because it's necessary for them to get this vaccine to avoid the H1N1 disease. So regarding here, they also mentioned on November 2, 2009, Business Week reported that Goldman Sachs, Citigroup, a number of the large employees in the New York City were given the vaccine to distribute. Although this company were to follow the CDC priority group guideline, there was an appearance that these employees were lining up jumping, especially after it was revealed that the Goldman Sachs received as many deaths as the Lenox Hill Hospital in the New York. At the same time, here the last paragraph, they also mentioned in Canada, it was reported that many Calgary Flames hockey players along the family members and the coaching staff and management had received the swine flu vaccine. None of these people were in the priority group. You see, because in above paragraph they mentioned the priority is only given for the children and pregnant women. But at the down they also mentioned some of certain cases the priority also given for the employers, because employees because they're having a lot of money to pay for it. I guess so like that. So now we're just going to go through the 5 questions from this paragraph and then we try to discuss it. During our discussion, try to give your own opinion and then try to relate your opinion with the relevant sources, or even you can justify with your opinion by highlighting the main points from the paragraph. Okay. For the first question, from the utilitarian point of view, who do you think should be the priority group? Yeah, who wants to begin first? Kayen, do you want to begin first?
I think Fatin will be the one who beginning first.
Okay.
Yeah, I have an idea.
Hmm.
First of all, let me give the definition of the utilitarian, which is a decision framework that ethically is based on the broad consequences of the decision, and that social decisions are considered before economic consequences. And it means that utilitarianism is a decision of the majority without considering self-interest. That's all.
Thank you, Fatin, for the definition. In my opinion, from the view of utilitarian, social consideration needs to be a priority. From the statement above, the person that is in the best position is to be to benefit society as whole, and they will be the one that needs to be a priority. In the case above, the vaccine should be given to those are first-line defenders. This is because their presence is required to vaccine and take care of those who get infected and they are in shortage. Besides, the high-level government workers such as president need to give priority because they are required to stay active to manage the pandemic.
I would like to add, furthermore, the country will suffer when a leader for the country is infected because no one can lead the country. As for the younger age group, there's no need to be prioritized because they just contribute to the country in the future, but not in the current situation. So I think the vaccination should let them inject at the last moment.
Thank you, Fatihah. Let's move on to question 2. Can you look
Sorry
at
for the
question?
interruption. If
Yeah.
doctor is here anytime, so Kayen or Sini, any one of you, if you saw doctor is here, please inform me or you guys can admit the doctor, okay? Yeah, Kid,
Okay.
you can go on.
Okay.
Sorry for the interruption. Yeah, Kid, you can carry on.
All right, it's okay. All right, so moving on to question 2. From a justice as a fairness perspective, who should be in the priority group? So, according to David Hume, the English philosopher, there is a need for justice for two reasons. Number one would be people are not always beneficent and they are scarce resources. So, the priority group in this case would be the one who, including people who cannot afford the flu shot, should be allowed to have the vaccine. What do you think, Fatin?
I wanted to add some points before we move to the next question. Beside people who cannot afford in terms of necessity or need, the priority group will include those who are most likely to get sick and suffer the more severe consequences, such as children, elderly, those with weakened immune system, pregnant women, healthcare and emergency medical service. Apart from that, in the term of who deserve, medical caregiver deserve the vaccine more than the business people because they will give the benefit in the greater group and will be needed in case of disaster. Should we move to the next question?
Yeah, for the next question, should people who make society flourish through their economic productivity, such as employees of Goldman Sachs, be put into the priority category? What do you think, Kirtanac?
Thank you, Prem. So yeah, answering the stated question, I most definitely think it's a yes. Why, you may ask? This is because Goldman Sachs has already have like almost 152 years of running of history until now, and it is also one of the first to get to be the securities and investment banking business. So it's also known for hiring young and ambitious and attractive people for its identity. So Goldman Sachs employees put in a lot of efforts and hours, and their work-life balance tilted strongly in favor of work. So there's an intense pride among Goldman alumni itself. So note that this is the only company that call ex-employees as alumni. So understanding that, they also have their own LinkedIn group that keeps everyone up to date to the latest going on. So from my perspective, they contribute so much to flourish the society through economic productivity primarily.
Sorry, Kate. I afraid I will have to disagree with you. Even though I do understand that Goldman Sachs employees are out putting efforts in means of flourishing the society through their economic productivity. However, other groups should be considered since they are given recognitions a bit lesser than Goldman Sachs. The best example I can give would be employee from Morgan Stanley or even JP Morgan. They also put equal effort as Goldman Sachs employee as well. So what is your opinion, Frank?
Yeah, I agree with you. The big four investment banks employees are putting a lot of effort equivalent to the other not recognized investment bank as well. All are going towards one common goal to flourish the society through economic productivity. However, when it comes to the ranking and score in 2020, Centerview Partners and Evercore took over the first and second place, putting Goldman Sachs the third. From here, we can see the priority group should be given to employees of Centerview Partners, as these end results will change as well.
Well, I have to agree with you both. Thank you for sharing your point of view.
Okay, well, so shall we move to the fourth question, since we have already have discussed for the three, and then we also got what is the main clear point of view ready. Other doctor is here now?
No.
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 Okay. Okay. Try to take our time, and then we try to go slowly one by one. We try to discuss it furthermore. Okay. For question number 4, who wants to begin first? Sini, do you want to do that? For
Yes.
should people
Yes.
who contributes to making life enjoyable, such as entertainers and athletes, to be put the priority group?
Yes, I have some opinion for this question. For
Mhm.
me, I disagree for the life enjoyable can be put into the priority group, because life enjoyable is considered as a relaxed group during that situation. So medical person should be given injection first, because they need to save more people and need to press themselves in crisis situation as first liner. However, for making life enjoyable, they no need to keep touch with patients, and they only need to be responsible for caring themselves. And simply saying, since their carer allowed them to stay at home, so there should not be a priority to receive a vaccine. That's my
Sorry,
opinion.
sorry, sorry,
Yes,
sorry. I'm not
yes.
totally agree with you. For the athletes who are representing the country to compete with other country, at least in international competition, therefore they are exposed themselves in a dangerous situation to contact with other people who may be in the virus carrier. Besides, entertainers like singers and actors will have more contact with fans or perform in foreign countries, and there may be a virus carrier to others. It may be a more critical infection cluster. Therefore, they should be considered a priority group to reduce the infection cluster.
Okay. Sorry, Chunho. I think I can get your point, but I'm not saying that they cannot receive vaccine forever. But since at now there are limited vaccine, not enough vaccine for everyone. So that can hold on first. We need to know pandemic H1N1 is virus is spread from person to person by causing or sneezing, or they can contaminate hands or surface. Just now you say they will meet with friends or contract other people, but I don't think they will go any art performance or sport competition at that time. I mean, they can choose to relax sometimes, or even choose for online perform and wait for the vaccine. That's my
Yes,
opinion.
you are right. The athlete can stop training or participating in competition, while the singers or actors can cancel the fans meeting. It is because they can avoid and prevent the infection once they are willing to do this. Therefore, they should not be considered as a priority group compared to other, especially first-line defenders. They are face higher risk than entertainer to control the disease.
Okay.
Yeah.
So we move to the next question, which is, if you were the CEO of the company that manufactured the swine flu vaccine, will you ensure that all of your employees were inoculated first, or would you recommend that they too wait in the line? So for this question, if I was the CEO of the company that manufactured the swine flu vaccine, I would ensure that all of my employees should not be inoculated first and recommend them to wait in the line. As we all know that a good person is the one who recognizes the distinction between right and wrong, and choose right as a moral. So moreover, as an ethical individual is the one whose morality is expressed in his or her desire to do the right thing, even though it is difficult or risky. So as a CEO, I should be a moral person that has an ethical behavior in order to keep my company and employees not to be portrayed as putting our own interests ahead of those in a higher risk or in need. So what do you think, Chunho?
Yes, I agree with Fatihah. As you can see, there are a lot of people in the priority group who are most likely to get sick and in the highest risk, such as pregnant women, caregivers of young children, healthcare workers, and medical service personnel. People from 6 months to 24 years old of age, and people from age 24 to 65 who have a greater risk of developing complications from the virus. So I think we should inoculate to those people first be compared to the employees as they are in the priority group as stated in the case.
Okay, as for me, I am not opposed the idea of Fatihah that say that a good person is the one who recognize the distinction between right and wrong and choose right is moral. So I not oppose that opinion that it's right to say like that. But I have my own opinion. If I'm one of the CEO of the company, that I would say that the employee health of the company is also important, right? Because of they need to continuously manufacture the vaccine. So we need to prioritize their health condition also, because if they are not have the vaccine first, because they will be might be exposed to the virus when they produce or manufacture the vaccine. So I think they need to be put in the first priority. So also they can contribute to the confidence among the society related to the efficiency of the vaccine. So to conclude, to summarize all the discussion of ours, I think it is wise for the company CEO of the company to coordinate with the government, medical, and their workers, their employees, to make the collective decision, because it is not such a small decision to make, because when it involve the community, the society, vaccine, because it's maybe it's limited of the in terms of the quantity of the vaccine is limited, so we need the collective decision. So I think it's wise for the CEO to coordinate with the government, so NGO or the workers itself, the medical workers, to apa to make sure the vaccine decision will make wisely. So if the vaccination priority will affect the production of vaccine, so it will be reasonable to include the workers in the first priority. Okay, that's all from me.
Yeah, okay, well said, Syahmi and Kayen. It's one of the strong statement for the question number 5. Okay, since I getting a lot of we actually we brainstorm our ideas, that we also express our own opinion regarding the which group they actually need to get the first priority. From Kirtana's point of view, she said that the young leaders should get the first priority because they are the one who really serve for the nation. And then for Kayin, he also mentioned the government staff, and then he also mentioned that people who really serve the country, they need to give the priority for the first. And then from my opinion, I also say that people who really so for the country as well, they need to get the first priority. And also people who are really in the category of very nearly have a high chances to affected by the H1N1, they also need to give the first priority. Because when we come for the priority we need to see first which group of people need to get first. That's the most important thing. And then same goes for the workers as well, because the workers, that company is one of the like fast consumer goods company. that workers also we need to give the first priority, because the workers are actually involved in the first line of production in the goods and services. If that focus is affected, whole country will be shortage of goods and services. you know these are the things that we really particularly need to concern about it. So I guess so all of our discussions have give a very clear picture regarding these issues. And then thank you so much for expressing your own opinions, and then regarding it, and also stating the relevant resources for this. Yeah, thank you everyone.
Thank you. Thank you.
Okay.
Thank you.
Thank you.
Thank you.